Dr. Christopher McGowan. Doc, nice to see you again.
Hey, Hena, great to be here.
So the concern is not whether the drug in question is legitimate, but how easy it is to buy weight loss drugs through online advertisements. I see it all the time. I know so many people that are on these drugs. Is that correct?
Yeah, that's exactly right. And this is yet another FDA alert about these compounded versions of semaglutide that are seemingly everywhere, and patients are being bombarded with advertisements for these compounded versions. Again, not the same as Ozempic and Wegovy. These are being supplied by compounding pharmacies. And a recent study showed that nearly half of online pharmacies selling these versions are in fact illegal. So people have to be very, very cautious when obtaining them.
And I'm sure people just see the prices because it's significantly cheaper than Ozempic or Wegovy. But the question is, how is this allowed to be advertised and sold without doctor's approval and, of course, doctor supervision?
Yeah, and they're often much cheaper because they aren't legitimate. And the truth is, if you are able to obtain them without a prescription, those are not legitimate. That is illegal. A proper compounding pharmacy that is licensed and accredited would require a prescription to obtain it. So that is one of the red flags. So if you are seeking these types of medications, be very, very careful. Look for accredited pharmacies or simply avoid these compounded medications because they are not FDA regulated. They lack that oversight.
Doctor, I wanted to talk to you about another concern. The Journal of the American Medical Association released a study linking these weight loss drugs to suicidal thoughts. What do you make of this study? How concerned should we be?
Yeah, so now we're talking about brand name Ozempic and Wegovy, and there have been some reports of suicidal ideation in patients using these medicines. Now, to be clear, those risks were not shown in the clinical trials, but this study in particular looked at real-world data. This was from the World Health Organization database of reported adverse events. Of the tens of thousands of side effects reported by patients using these medicines, there were 160 some cases of suicidal ideation. Now, I don't want to disregard these findings, but we have to be really cautious in interpreting them because these are self-reported side effects. So we're kind of lacking context. But the reality is that every medication has side effects, and losing weight in and of itself does have psychological effects.
Doctor, what do you tell your patients if they ask for Ozempic or Wegovy?
Yeah, that's a complex question. So we know that we have a lot of treatment options now, and for some patients, it may be Ozempic, or Wegovy, it may be Zepbound. These are great new treatments, but we really want to meet with the individual and determine if it's the best treatment path for them. And we want to talk about these potential side effects. We want to talk about all the other effects of these medications, including some of the downstream health benefits that we're seeing. So it's really about the patient and their overall goals.
Are patients telling you they just feel the pressure to take these drugs because seemingly everyone around them is taking it or losing weight?
So there may be some external pressures in some cases, and that can contribute to some of the psychological effects. But truthfully, the patients that I see want to lose weight because they just want to feel better. They want to feel more confident. They want to improve their health.
Sure. There's also new information about how these drugs could help with diabetes. What do you make of those findings?
Yes, so the latest top-line results from the longest-running study of tirzepatide were recently announced, and they showed that patients who had prediabetes and took tirzepatide, which is Zepbound, had a 94% reduced risk of developing diabetes. So that's a big finding, but it's also not surprising because tirzepatide is also a diabetes treatment. So of course it reduced this risk, but this does speak to also those health benefits of losing weight.
As a specialist, Doc, what does healthy medical weight loss look like? What should we know?
Yeah, so losing weight is about so much more than just the scale, so much more than the numbers. When you lose significant weight, you're improving diabetes risk, you're improving blood pressure, cholesterol, sleep apnea. That's really what it's about. And I think one of the bigger takeaways from this study, it is the longest running study. That's great. It shows great safety. But what we also saw is that patients, when they discontinued the drug at the end of the study, experienced weight regain. And we need to keep that in mind because these medications, while highly effective, must be taken continuously. And that's the discrepancy that we're seeing between this clinical trials where patients are provided drug for free continuously and the real world where it's so difficult to access them.
Dr. Christopher McGowan, we always appreciate your time. Thanks for waking up with us.